First and foremost, I really appreciate the School of Nursing to try to accommodate everything that's going on, to try to meet our learning objectives and make sure that we are well-prepared nurses as we approach graduation in the workforce. What really worked well is that they really helped out our flexibility and adaptability skills, which are really key when it comes to nursing.
Another thing that teachers did to help the students during the COVID-19 pandemic was they became a lot more flexible with their lab technique. During our upper evaluation class, we did 2 different lab activities that we would not have done if we did not have the COVID-19 pandemic, which is we performed different tests on different family members. This was a good experiment because we got to learn how to do the different tests on different sized bodies. So for example, I did tests on my 50-year-old father, but then I also did tests on my 13-year-old little brother, and they have 2 very different body sizes, so it really allowed me to practice on different bodies.
One particular example in my case, I was in Dr. Henry's 408 research methods class this year, and we were actually working on a research project that we're hoping to get published. It's been sent out to a journal, and we actually had the opportunity to present it at a virtual conference, which was really great. But one of the things that was just mind-blowing to me that I never expected was the time and effort that she put into not only our group, but all of the other research groups in that class.
Since most of my classes are online this semester, they have tried really hard to communicate with us through emails, through discussions of how we're doing emotionally, mentally, how we're doing with our job searches, and comparing it from last semester where everything shifted to online. They've tried really hard to ensure that we've had in-person experiences in the hospitals and the clinics, just so we can have those hands-on experiences before we go on to the workforce.
Community engagement is a staple of the occupational therapy program, and experiential learning has not stopped even amidst the pandemic. For example, I've been working on YouTube tutorial videos and online activities with some classmates for 3rd through 7th grade children to be able to work on. We also are in our assistive technology class, and we've been working on some unique devices that we're going to give to a couple members in the community who have asked for our help, and we are so blessed to be able to continue this community engagement throughout Harrisonburg and the surrounding areas.